Today, matters of the heart take center stage as several cardiac-related stories are creating quite a buzz within the medical community. Here to fill us in on the latest is Dr. Chris Magovern, ABC News medical contributor and cardiothoracic surgeon at the Morristown Memorial Hospital. Dr. Magovern, thanks so much for joining us today.
Great to be here.
So first of all, tell us about these exciting new developments involving minimally invasive procedures.
Well, for 40 years now in the United States, we've been performing aortic valve replacements. It's the second most common operation that we as cardiac surgeons perform. And we do it routinely, we do it safely. We've done it in some notable personalities, including Barbara Walters and Arnold Schwarzenegger. And we have excellent results doing it this way. But the problem is that we always have to crack the chest. We always have to open the chest to do this operation. And sadly, there are many patients that may benefit from this operation that aren't healthy enough to have that approach. So that has prompted and motivated medical device companies to come up with these new techniques, innovative techniques that are less invasive to replace the aortic valve without having to open the chest. And this is the way it works. We take a valve that's very similar to the type of valve that we put in with an open case, and we collapse it on top of a catheter. And then we insert this catheter into an artery in the leg up to the level of the heart, and then it's expanded in the heart and anchored into location.
A catheter such as this?
Just like this.
All right.
It's revolutionized how we think about being able to do heart surgery without having to open the chest.
Unbelievable. And what have the results been so far using this procedure?
The New England Journal of Medicine just released 2 weeks ago some data, some preliminary data about this new valve, and it's actually quite favorable. They looked at over 350 patients. These were patients that were quite sick. They were turned down for conventional surgery. They weren't healthy enough for that operation. And they randomized these patients into one of two groups. One group had this new procedure, the other group had nothing done. And after 1 year, the patients that had this procedure had a 50% increased survival rate.
Fantastic.
So it's encouraging that we've got something for these patients.
Very, very encouraging. Now, is this procedure for everyone, or are there certain people that are better candidates than
Great
others?
question. We would love for this procedure to be for everyone because it's so less invasive, but it's not ready for prime time yet. There are risks, there are complications associated with this. What we know is that this is better than nothing for patients that don't have any other options. But when we compare this operation with the standard operation we do, it's not quite as good. The results just aren't as good.
Oh, really? So for a healthy patient, otherwise healthy patient who can withstand the chest cracking that needs to happen, you would still perform the traditional procedure?
That is exactly right. For a healthy patient, they should have the standard procedure. For sicker patients, this may be an option. But we're getting better. We're getting better every year.
Right.
And the technology is improving. We're gaining more experience. So I'm confident that in the next 5 years, we'll probably be able to offer this to most patients.
Very exciting. Very,
is.
very exciting. Now let's switch gears a little bit and talk about Consumer Reports, because it's sort of fascinating that Consumer Reports has started rating cardiac programs across the country.
Unbelievable.
What are your thoughts on this?
Well, in this day and age, the internet has really enabled consumers to know more about a lot of different things, including healthcare. Every single week I have patients coming into my office with reams of paper they've downloaded from the internet, telling about what kind of operation they need to have or how it should be done. And we as surgeons are becoming more transparent. We're offering more data about our results. And this has created a perfect storm, if you will, where patients get more information, we're giving more information. So now Consumer Reports, the mother of all consumer reporting agencies in this country, is rating us, not just medicine, but they've focused on heart surgery and our bypass operations.
Now we know your own program was rated very highly. Congratulations. Within the medical community, is there some controversy over this rating system, or?
Sure. It's a, you know, as you said, we were rated highly, so my partners and I, who were one of 50 programs in the country that received the highest 3-star rating, we're delighted about this, and we think it's great. But it's a double-edged sword. If you have a program that has good results, you're going to be delighted about it. If you have a problem that has poor results, you're probably not going to want to expose yourself. But honestly, for what we do, it's so important. It's life and death that we're dealing with, and these are hearts, that we really shouldn't tolerate any programs that have poor results.
Absolutely.
And we should encourage all programs to try to excel in it. And I think we'd be happy if all programs could have 3-star ratings.
Absolutely. So how did Consumer Reports go about gathering their information? They're known for, you know, rating refrigerators and cars. How did they rate the medical program?
What they didn't do is they didn't hire some summer interns and send them into a hospital and have volunteer heart surgery and fill out a questionnaire. But they were very clever about this. They partnered with industry, and they partnered with our biggest organization called the Society of Thoracic Surgeons. This is an organization, Tanya, that monitors surgical outcomes across the world. They monitor 1,000 different cardiac surgery programs and over 5,000 surgeons, and they keep data on how well we do. And with the surgeon's permission, they shared this data with Consumer Reports, and they put together a list of about 11 different items that they thought were important, whether the patient survived, whether the patient had any complications, whether the patient was on the right medications, whether the patient had the proper procedure, and then they were able to compile a list and rate these programs with either 1, 2, or 3 stars.
Fascinating. Now, do you have any insight as to why they started with heart programs and whether Consumer Reports has plans to expand this rating system?
I think they probably started with us because we've been so compulsive about keeping data, and we had all this data available to us so that we could have it for them and make it easy. And are we going to move forward with this? Absolutely. There's no question that other programs, or other disciplines, I should say, such as cardiology and orthopedic surgery, will soon be doing the same thing.
Fantastic. Well, Dr. Chris Magovern, thank you so much for joining us today. And for more health information, be sure to visit us on the health page at abcnews.com.